discuss today is then sampling technique and sampling designs, right? Okay. So in the previous class what we had discussed is that we had discussed the introduction to research methodology. We had discussed that while doing a research we need to form a well structured research question. And how can we arrive at a research question? In order to arrive at a in order to arrive at a research question, what we must first do is we must first do a review of literature. By doing a review of literature, we find that okay, suppose we have a topic of interest, we do some review of literature and we arrive at a research question. Okay. Once we have a research question, now our research questions can be of two types. Research question can be such which is an open question, where we may say that how is the situation of a particular disease in a particular area. Okay. So here we are not trying to establish any relationship or anything. What we are trying to do is we are simply trying to describe the problem. Okay. In this case we just have a research question which is an open-ended question, and the answer to that open-ended question is a descriptive research that we conduct. Okay. Now once we have some description on subtopics, then there is another kind of research that we do, which is analytical research. In analytical research what we try to do is we try to prove or disprove something. For example, once I see that okay, I have first asked that what is the pattern of lung cancer in a particular community. Now then I have found out okay, lung cancer is this much, this much is small cell lung cancer, this much is non-small cell lung cancer, this is the age group, this is the that. I found that out. Now this is my first open-ended research question and I have done a descriptive research. After that I want to find out that what is the relationship between smoking and lung cancer. Okay, that is the initial research question. So out of that I feel that probably smoking causes lung cancer or smoking leads to lung cancer. Now in our realities we cannot prove anything, we can only disprove things. Okay, we cannot prove anything, we can only disprove things. Suppose I tell that tulips are red. Okay, now I have to show you 1000 tulips to prove that tulips are red. But if you show me only a single yellow tulip, that proves that tulips are just not red, they are yellow also. So I cannot prove that tulips are red by showing you that tulips are red. But I can prove that tulips are not red by showing you a single yellow tulip. So it is much easier to disprove statements than to prove statements. So whenever we have a research question, an analytical research question, what we do is we frame a hypothesis. We frame a hypothesis. So what is a hypothesis? A hypothesis is like, so suppose smoking and lung cancer, then we can have a hypothesis that history of smoking is associated with lung cancer, right? Now but just like I said, I cannot prove this. So what we do is we disprove the opposite of what we want to prove. Like I want to prove that smoking is associated with lung cancer. So instead I will make the statement like smoking and lung cancer are not associated. So if I can show that there is any relationship between the two, then this statement is proved wrong. That automatically proves that the alternate statement is right, which is smoking is associated with lung cancer. So when we do analytical research based on the research question, we take up something known as null hypothesis. And the null hypothesis shows that, so the null hypothesis will be like smoking and lung cancer do not have any relationship. So if we can prove that there is any relationship, then we disprove the null hypothesis and the alternate hypothesis becomes proved, which is smoking and lung cancer have a relationship, isn't it? So for analytical research we take up a hypothesis. For descriptive research we only have a research question. Now once we have a research question or a hypothesis, based on that we select on the research methodology. So what research methodology? So there are different types of study designs as we were discussing in the previous class. That studies, they can be simply, so suppose we are doing something to the population. For example, we are giving them some exposure or we are giving them some intervention. Then those studies are known as interventional studies or experimental studies. And if we are not doing anything, we are just looking at the scenario, then those kind of studies are known as observational studies. Those kind of studies are known as observational studies. Now again, observational studies can be of two types depending on the type of research question. If I have a descriptive research question, then I do a descriptive observational study. If I have a research question that wants to prove or disprove a hypothesis, then I will do a analytical observational study. So observational studies can be descriptive or analytical depending on whether I have a open research question or I have a hypothesis that I want to prove or disprove. If I want to have a hypothesis that needs to be proved or disproved, it's an observational analytical study. If I have a hypothesis, I don't have a hypothesis, I only have an open-ended research question, then I do a descriptive observational study, isn't it? When we are doing intervention or when we are giving an experiment, when we are giving an exposure, we are always trying to look at the effects of that exposure, okay. So experimental studies are more or less always analytical, okay, because we are doing an exposure, and once we are doing an exposure or an intervention, we want to see the effects of that exposure or intervention, right. So there is definitely a cause effect thing that is there in the experimental studies or interventional studies. So they are always analytical, right. Now in observational studies, descriptive studies or analytical studies, we can do different types of study. Suppose we go to the population and collect data only once. We go to the population, collect data only once. We take a snapshot of what is, suppose I want to look at what is the prevalence of hypertension in a certain village. I go to that village, measure BP, look at whether they are already having hypertension and taking medications, and come back. This kind of study is known as cross-sectional study. I collected data in one sample and this is a cross-sectional study, right. Now cross-sectional study can be descriptive also, can be analytical also. If I just want to find out what is the prevalence of hypertension, then it is descriptive. If I want to look at what is the prevalence of hypertension and salt intake pattern in the community, then it can be analytical also. I can relate the salt intake with the hypertension. But the only problem is I cannot expect which came first. I cannot establish whether hypertension occurred before they started taking more salt or taking more salt happened before development of hypertension, because I am only taking data at one time. So I do not know which happened when, okay. So this is about cross-section. Other kind of data collection can be study design, observational study design can be cohort study. Cohort study. Cohort study means I take a population, I follow them up for a period of time, right. I follow them up for a period of time. Now here also it can be a descriptive cohort also, it can be a analytical cohort also. Descriptive cohort means suppose I want to look at the natural history of tuberculosis or natural history of HIV, okay. Then what will I do? I will take up all people who test positive, or I will take maybe people who have the risk factors. Maybe I take sex workers or IV drug abusers, and I am following them up for a long period of time, right. If they develop HIV, if they test positive for HIV, then I will be able to study the gradual progression of the disease in them. So this can be a descriptive cohort where I am not having any analytical research question, but I am just observing a particular natural history of a disease I want to find out, okay. I can do it by a descriptive cohort. I can also do a cohort study with an analytical perspective. For example, I want to see whether smoking leads to lung cancer. Now, then I will take a proportion of smokers, I will take a population of smokers and I will observe them over a period of time and I will look for the development of lung cancer. So here what we are doing is we are trying to establish the relationship between smoking and lung cancer. But the problem is the time for follow-up is very long And there is an ethical thing also, that people are smoking. My responsibility is to stop them from smoking. How can I say that you keep smoking, I'll just follow? So we need to intervene there. Despite our intervention, they might continue smoking, we can follow that up, but we must intervene. Okay, when we know that something is harmful, we cannot let that exposure continue just for us to study the natural history of disease. It has got ethical constraints, isn't it? Next, another type of study is case control study. Case control study where we already have the disease. So we want to show the disease, find the relationship between smoking and lung cancer, but I do not have the time to follow people up for 20-30 years to see whether smoking leads to lung cancer. So what will I do? I will take people who have lung cancer. Them I will call as cases. And I will take people very similar to those people who do not have lung cancer. Maybe from the same hospital, maybe from their localities. Okay. And then I will look at the history of smoking in them. So I do not actually follow up over a long period, but in the case and the control, I take the history of the exposure. Okay, and from the history, I try to establish, okay, whether people having lung cancer, more of them were smoking than people not having lung cancer. Then I can say that, okay, among lung cancer, smokers are more, so definitely smoking could be related to lung cancer. I can say something like this. Okay. So when we are going from the exposure to the disease, we do a cohort. When we are going from the disease, taking back the history of exposure, then we are going from disease to exposure. Then we do a case control. Okay. Now the thing is, whether we want to do a case control study or a cohort study or a cross-sectional study, or also suppose we are doing we'll do an experiment. We'll do an experiment. For example, we'll look at the effect of a smoking cessation program on, say, farmers. Effect of a smoking cessation program on farmers. Then we are doing an effect of, we are giving an intervention, a smoking cessation program, and we'll see whether that reduces their smoking rates and whether that leads to reduced morbidities as a result of smoking, right? So for this will be an interventional study. Intervention study can also have different types, we'll discuss them later. But what we understand is that whether we want to do a cross-sectional study, or we want to do a cohort study, or we want to do a case control study, or we want to do a interventional study, what we must do is we must include some participants. We must include some study participants. Now, cross-sectional study is still cheap because you will be doing it. You just go collect data once and come back. But think of something like a cohort. In a cohort study, you have to follow people for 5 years, 10 years, 15 years, 20 years at times. Okay. So for them, every participant that you include, there is a cost associated with that. You need to keep that contact with that person, keep repeatedly visiting the person, or the person has to keep visiting you. You have to collect data for a period of time, require researchers who will go collect data, tabulate all of that, analyze and all of that. For every participant that we include in research, it has got some cost associated with it. Cost not only in terms of money, but cost also in terms of manpower, cost also in terms of time, cost also in terms of effort, cost also in terms of coverage, travel, all of these things, isn't it? So for these things, we cannot include everyone in research. We cannot say that, okay, I want to find out what is the state of adolescents. Say, what is the state of adolescents with respect to nutrition in West Bengal? Now, for doing this study, I cannot include all adolescents of West Bengal. It is not feasible. Even if I say that I want to find it in Birbhum district of West Bengal, then also I cannot include all adolescents of Birbhum district because time consuming, difficult to get everyone, cost, all of the things that I just discussed. For that reason, what we do is we do a thing known as sampling. So what is sampling? Sampling is selection of a, it will be good if it is representative, selection of a representative set of participants from the total study population in order to get findings which can be generalizable to the population. Like there is a population of adolescents in Birbhum district. I want to find out their nutritional status, but I cannot cover all of them. So what I will do is I will try to select a few of them in such a way that the people I select are a representative population of the adolescents of Birbhum. So I will have to include adolescents from different religions, different age groups, different genders, different socioeconomic status. I will have to include them so that the adolescents in my sample represent truly the adolescents of Birbhum. Now, if my adolescents of my sample truly represent the adolescents of Birbhum, then what will be the advantage? The advantage is that what information I will get from these adolescents, I can generalize that information to the all adolescents of Birbhum. Suppose I say that the adolescents I choose, among them I find a 20% prevalence of anemia. Then I can, if my sample is good, representative, then I will be able to say that probably the adolescents in Birbhum, 20% of the adolescents of Birbhum really suffer from anemia. But if my sample is not representative, suppose I want to do a estimation of anemia among adolescents in Birbhum, and I only take adolescents from the most expensive private schools of Birbhum, then what will happen? Automatically only adolescents from well-to-do families come to the expensive private schools. So maybe I will find a 5% prevalence of anemia, and I will think falsely that the prevalence of anemia among adolescents of Birbhum is 5%, but that is not true. Not true. So why did this become false? Because my sample is not representative of the population among whom I want to do the study. Okay. So whenever we take a sample, one of our key objectives for sampling must be that our sample must be representative of the study population that we are considering. Okay. So as we go into the discussion, let us go ahead. So there are some terms that we need to be aware of. First of all is universe. Universe. So what is the universe? Universe is the entire population. Universe is the entire population. Okay. What is the study population then? Study population is the population on which the study is being done. For example, I know that anemia in adolescents is a problem. Then adolescents constitute the universe. But when I do the study, my capacity is within Birbhum district of West Bengal only. Then suppose if I am able to sample from entire Birbhum district, then the entire Birbhum district, adolescents of Birbhum district are my study population. Now suppose I say that here, what is sampling unit then? Sampling unit is how I will select the individuals. Suppose I say that I will first select blocks from the district, then I will select schools, then in schools I will select classes, and from classes I will select individuals. Then here individual adolescents will be my sampling unit. Suppose I say that I want to do a survey of immunization coverage, vaccination coverage in the village. Then how will I select? Then I will have to select houses. If I go to the village and do a study, then I will have to select houses. Then the houses in the village will be my sampling unit. From that houses, we will select one child. Okay. So what we select by sampling, that is our sampling unit. What is our sampling frame then? Sampling frame is all of the individuals, the list containing all of the individuals is the sampling frame. So suppose we do a sampling in multiple stages, like I just said. For example, suppose I want to do this study on adolescents in all of Birbhum. Okay. Now in Birbhum district, I might be having many blocks. Now it will not be able to possible for me to cover all blocks. So maybe I say that I will select 10 blocks. So in the first stage, when I select blocks from the district, okay, or maybe 5 blocks I will select. When I select 5 blocks from the total, maybe there are 30 blocks. So the list of those 30 blocks will be the sampling frame. And I select 5 blocks from that. So each block is my sampling unit. I have selected 5 blocks. Now once I have selected 5 blocks, then maybe in the next stage, I am going to select schools within the blocks. So maybe in those selected 5 blocks, in each of those 5 blocks, maybe there are 20 schools. So from those 20 schools, again I say that I will select 5 schools. So in the second stage, the sampling frame are the 20 schools in that block. And I select each school is my sampling unit, I select one school. Now once I go to the school, I will say that I want to include 50 adolescents from that school. So the students who are studying from class 6 to class 12 are adolescents. Then I will have a list of all the students studying from class 6 to class 12. And if I say by random sampling, I will select 50 students from this list of all students from class 6 to class 12. Then all students from class 6 to class 12 are my sampling frame, and one student is my sampling unit. Okay, like this. So sample is a small representative portion of the whole. So going ahead, what is sampling then? It is the procedure by which some members of the population are selected as representative of the study population. We have already discussed this, and we have discussed that sample needs to be representative of the study population in terms of time, place and person, right? So if the study, suppose I want to do in all of West Bengal, then I must have some sampling from the delta area of Sundarbans. I must have some sampling from the Gangetic plains. I must have some sampling from the dry areas of Birbhum and Bankura and Purulia. I must have some sampling from the hilly areas of Darjeeling, isn't it? So there has to be some diversity in terms of place to make it representative. Diversity in terms of gender, male, female. Diversity in terms of socioeconomic status, upper class, middle class, lower class, very low, below poverty line. Everyone has to be there in the sample if everyone is there in the study population, so that the inferences of the sample can be generalized to the. Why do we sample? We have already discussed this. We sample to minimize financial costs of collecting information, to minimize time and resources, to obtain information from large populations, to ensure efficiency, and to obtain more accurate information. Because if we try to cover everyone, then the amount of time we can spend with each one becomes less. So we will rather go in depth with a sample than collect superficial data of everyone, isn't it? So types of sampling technique. Now sampling can broadly be classified as probability sampling and non-probability sampling, or random sampling and non-random sampling. So what is probability sampling? Probability sampling is a sampling method where every individual has a predictable probability of getting selected in the sample. Okay, suppose like in this process, the process I just mentioned, that 20 blocks from that 5 blocks, 30 schools in each block from that 5 schools, and then again maybe 400 students in one school from that 50 students. So for each of those 400 students, I can find what is the probability of them getting selected into the sample. Now if I did not do this randomly, if I did it like, আচ্ছা ওকে ভালো লাগছে ওকে নিয়ে নিলাম, একে ভালো লাগছে না একে বাদ দিয়ে দিলাম, এই স্কুলটা আমার বাড়ির কাছে এই স্কুলটা নিয়ে নিলাম, ওই স্কুলটা অনেক দূর ওখানে এসি নেই ওটাই যাব না ওটা বাদ দিয়ে দিলাম, তাহলে কি হবে? Then the people within those units will not have a predictable probability of getting selected into the sample. Okay, so in a random or a probabilistic sample, every individual or every sampling unit has a predictable probability of getting selected into the sample. It might be exactly equal for all individuals, as is the case with simple random sampling. Suppose I have 50 individuals, in a single way from that 50 I will select 5 randomly. I will generate 5 random numbers and I will select 5. Then each one has a probability of 5 by 50 of getting selected. Then every person has got the same probability, predictable also and equal also. Okay, but sometimes what happens, suppose I said that okay I selected 5 blocks from the 20 blocks, then I selected 5 schools from the 30 schools. Now of the 5 schools I selected, I will collect 50 individuals from each school. Now it might so happen that one school has a student strength of 600 while another school has a student strength of 450. If from both the schools 50 people are getting selected, then essentially the probability of selection is not exactly equal, but at least it is predictable and comparable. Okay, so for all of the probability or random sampling techniques, the characteristic is that every sampling unit has a predictable probability of getting selected. It is not like it is someone's whims or choices or easy or difficult by which they will be getting selected. No, they get selected by a probability, by a mathematical chance of getting selected, and that probability is predictable. Okay, so since that probability is predictable, the chances that the sample is representative of the study population are greater. Okay, are greater. Okay, so for non-probability sampling, as I was saying, non-probability sampling, it does not depend on the laws of probability. Non-probability sampling is okay. There are 20 blocks in Birbhum district. Now I am staying in Bolpur, so I will look at which blocks are near me, in and around me, which I can quickly travel and come back. I will select those blocks. And now Rampurhat is far away, I will let it go. Nanur is close by, I will take that. Okay, so this is non-probability sampling. A sampling unit, an adolescent of Rampurhat will then have no probability of getting selected in my study because I am excluding them by virtue of feasibility or ease of access. This is non-probability sampling. Okay, non-probability sampling means does not depend on laws of probability. Probability of being selected is unknown. No one knows. It is according to my whims and choices. I like someone, I will pick that person. I do not like someone, I will exclude that person. So can you predict who will get selected, who will not get? No. No prediction. Right? And it is non-random. As I say, non-random, it cannot be generalized also. Now can I take a sample from only Nanur and Bolpur and say some other block and then say that it is generalizable to all of Birbhum? If I have not sampled anything from Rampurhat, from that side of Birbhum, then how can I generalize the findings to all of Birbhum? Okay, so a non-random sample or a non-probability sample is not generalizable to the entire population. Okay, next, it is definitely then inferior to probability sampling because my objective of sampling is to make the sample representative of the study population. But if I am not doing it as per as probability, then I am doing wrong, isn't it? Then this is not generalizable. If it is not generalizable, my findings of my study are as good as useless. I did the study, but if the findings of the study are not applicable to the population on which I wanted to do the study, then it is useless, isn't it? And it is not amenable to statistical analysis. Why do we do statistical analysis? We do statistical analysis to find that whether a finding in the sample is also generalizable to the population. Okay, whether a mean of the sample, how close is the mean of the population to the mean of the sample. Suppose I want to find out what is the average screen time of adolescents in Birbhum, and I do a study. Then I do statistical tests to find out, and I find out in my sample the mean screen time is maybe 4.5 hours. Now I want to find out how close is this real screen time of Birbhum to what I have found in my sample. Now this can only be done if my sample is a representative sample of the study population. If I have taken a sample only from places according to my whims and choices, then the mean of the sample will not be equal to the mean of the population, and statistical tests should not be applied there. Okay. So what are the advantages of random sampling or probability sampling? Exactly opposite things, that is, it obeys the laws of probability. So everyone's probability of getting selected can be calculated, right? And so the probability of getting selected is known, as I have said here. It is a random sampling. We are able to draw conclusions about the population from the inferences drawn out of the sample. That is, the findings of the sample are generalizable to the population, isn't it? And also it is amenable to statistical analysis. We can say with statistical certainty, we can find out what statistical certainty we have about the findings of the sample being generalizable to the findings of the population, right? So what are the different types of non-probability sampling? So these are the various types of non-probability or non-random sampling. One is purposive sampling, one is convenience sampling, then we have self-selection sampling, we have snowball sampling, we have extreme or deviant sampling, we have intensity sampling, criterion sampling, quota sampling. So these are all types of non-random or non-probability sampling. Okay. Non-random or non-probability sampling also we do in research. Okay. We need to do at times, when we will discuss. Okay. Next, probability sampling. So what are the different types of probability sampling? The different types of probability sampling are simple random sampling, systematic random sampling, stratified random sampling, cluster random sampling, multi-stage sampling, multi-phase sampling, sequential sampling, and lot quality assurance sampling. What I discussed for the adolescents in Birbhum was a multi-stage random sampling, isn't it? First we selected blocks, then we selected schools, then we selected students. So we did it in different stages. So it was a multi-stage sampling. Okay. So there are different types of probability sampling. We will discuss each one of these. Okay. What each one of these are, we will discuss them. Okay. So far, are you good? So far? Huh? Any problems? Okay. So in cross-sectional study, we usually take a population and we try to find out in that how many cases are there. Okay. There will be many people who are not cases. And then we find out predictors in general. Suppose I take a village. In that village, I find out how many are hypertensives. Okay. And in that, among that, I find out that I also find out things like how many are smoking, how many are sedentary, how many are excessive salt consumption. And then I can form tables as hypertensive, non-hypertensive, and then salt consumption, smoking, we can distribute. But the thing is, the population having hypertension and the population not having hypertension can be very different. That is, they might not be comparable. It might happen in a cross-sectional study that the elderly have hypertension, whereas the younger people are not having hypertension. Then if I want to find out the effect of smoking as hypertension, I cannot find there, because age is itself. So for us to establish the relationship between one factor and another factor, the other factors which could be modifying here need to be similar. You understand? Like I can say that this hypertension is due to excessive salt consumption only if hypertension and non-hypertensive are similar with respect to age, similar with respect to smoking, similar with respect to alcohol, similar with respect to physical activity. Then only I can say that the only thing different between these two is salt consumption, and therefore salt consumption is related or not related to hypertension. Okay, that is the problem with a cross-sectional. What we do in a case control is that we select, suppose I want to, in case control we have a specific research question in mind, that okay, I want to see the relationship between hypertension and salt intake. Then when I select the cases and controls, I will try to match for the known variables. These we call as confounders. Variables which can impact the outcome are known as confounders. Okay? So what we do in a case control study is we match for the known confounders. For example, we are selecting hypertensive and non-hypertensives. Okay. Then what we will do is, for every hypertensive that we select, when we select a non-hypertensive, if this hypertensive is a middle-aged female smoker, then I will select a middle-aged female smoker non-hypertensive, such that my cases and control are comparable in every other aspect other than my exposure of interest. Okay, so a case control study is a much more refined way to find out the relationship between an exposure and an outcome. We have a specific outcome and a specific one or two exposures in mind. Okay, a cross-sectional study has an outcome in mind, but it does not want to focus on one or two specific exposures. It finds out which could probably be the exposures. Once it finds out, then it will go match few of those and try to assess one or two of those by doing case control studies. So before doing a case control, ideally some cross-sectional needs to be probably done. From cross-sectional, you can find out 7 factors maybe for hypertension. Then you will match for 5 factors in the case control and assess 2 factors with respect to relationship with hypertension. Would I make sense? বোঝা গেছে ব্যাপারটা? ক্রস সেকশন আগে একটা কনস্ট্রাকটিভ পিলারে আমি আগে ক্রস সেকশনাল করে দেখে নিলাম যে আচ্ছা ঠিক আছে, হাইপারটেনশনের সাথে স্মোকিং রিলেটেড, হাইপারটেনশনের সাথে সল্ট ইনটেক রিলেটেড, হাইপারটেনশনের সাথে এজ রিলেটেড, হাইপারটেনশনের সাথে ডায়েট রিলেটেড, স্লিপ রিলেটেড, স্ট্রেস রিলেটেড, এগুলো সব রিলেটেড। তাহলে আমি যদি দেখতে চাই যে সল্ট কনজাম্পশনটাকে চেঞ্জ করলে কতটা ইম্প্যাক্ট হতে পারে, বা আদৌ শুধু সল্ট কনজাম্পশনের উপর ইন্টারভেনশন করে হাইপারটেনশনের বার্ডেন কমানো যাবে কিনা, তাহলে আমাকে অন্য ফ্যাক্টরগুলোকে কন্ট্রোল করে তবে দেখতে হবে। তো আই উইল ম্যাচ উইথ রেসপেক্ট টু, আমি যখন হাইপারটেনসিভ আর নন হাইপারটেনসিভ কেস কন্ট্রোলে সিলেক্ট করব, আই উইল ম্যাচ দেম উইথ রেসপেক্ট টু এজ, উইথ রেসপেক্ট টু জেন্ডার, উইথ রেসপেক্ট টু স্মোকিং। ঠিক আছে, নোন কনফাউন্ডার গুলো দিয়ে আমরা ওদেরকে ম্যাচ করে নেব, যাতে আমি শুধু সল্টের ইফেক্টটাকে কোয়ান্টিফাই করতে পারি। ঠিক আছে, দিয়ে যদি এটা পাই, তারপর আমি তাহলে বলবো দেন প্রবাবলি interventions to reduce salt intake will be effective in controlling hypertension. Then I will go to for a interventional study. Okay? So this is why how stepwise we go from one study design to another study design for generating evidence. Now coming back to our probability sampling. So what are the different types of probability sampling? Simple random, systematic random, stratified random, cluster, multistage. সব কটা ডিসকাস করব না, যেগুলো ইম্পর্টেন্ট ওগুলো discuss. First and foremost is the simplest one, which is simple random sampling. So simple random sampling এতে আমরা কি করি? Here each sampling unit has an equal chance of getting selected. Just like I said, suppose this class I want to select 5 individuals from 50 individuals. ঠিক আছে? So I will generate I will have a table containing 1 to 50 numbers written there. 01, 02, 03, 04 up to 50. Okay, then maybe I'll bind my eyes and I will randomly point on 1. Like this, I'll point 5 times and one will get selected, or I will put 50 cheats, I will pick one. So randomly one will get selected. So this is the way where, so every cheat has a equal probability 5 by 50 of getting selected, isn't it? So this is about simple random sampling, that it is very simple, very easy, one step process, and every person has an equal chance. Not only do they have a predictable probability, the predicted probability for each sampling unit is equal, okay. But it can only be done when the study population is a small, homogeneous, readily available population. Okay, suppose I want to find out how many people coming to the OPD have undiagnosed hypertension. Can I do a simple random sampling? No, because I do not know how many people will come to the OPD. I do not have their names from before. Okay, so for doing a simple random sample, we must have a specified population, and that population has to be homogeneous. Okay, suppose just like this study in adolescents of Birbhum. Can I do a simple random sampling? Very difficult. I will then have to find out the list of students of all the schools of Birbhum and then randomly select from there. Now what might happen? One school gets selected in Rampurhat, from that I get 2 students. One school gets selected in Nanur, from that I get 1 student. One school gets selected in some other place, and from that Bolpur, from that I get 1 student. So I will have to go here, there. So difficult. Again, what might happen is, suppose my sample is very small, 50. So it might so happen randomly that all 30 out of the 50 came in Bolpur, while all of the other blocks got only 20. It can happen because it is random. So simple random sampling becomes effective only when the study population is small, homogeneous and specified. That is, I have the entire sampling frame. Okay, I must know who all are there in my study population. They must be homogeneous and it must be small. Then I can do a simple random sampling. Suppose you want to do a study on undergraduates of Santiniketan Medical College. Then simple random sampling can still be done. But here also there is a problem. Suppose you want to do it on their knowledge of hand washing. Then you actually must select, suppose you will select 100 people. Now if in that 100, 70 get selected from first year, or 50 get selected from first year, 20 get selected from second year, 20 get selected from third year, 10 get selected from final year. And in another time, 50 get selected from final year, 20 get selected from third year, 20 get selected from second year, 10 get selected from first year. Will the findings of both these samples be same? No. Because the knowledge of hand washing gets augmented as you go from first year to final year. So if you want to do this study, then you will have to sample from each of the years evenly. So maybe 25 individuals from first year, from second year, from third year, from fourth year. And this is what is known as stratified random sampling, where we divided the population into some strata. I will come to it. So what are the advantages of simple random sampling? It is simple and sampling error can be easily measured. Disadvantages? So as I said, complete population list must be available, and it may not be a true representative in a case of small sample size. Like I said, that all adolescents of Bolpur I want to study, of Birbhum I want to study, and my sample size is only 50. So maybe few blocks do not get any representation. Okay. So if the sample size is small and the study population is large, then simple random sampling does not give a representative sample. Next. So this is how we do it. See, there is a list of 48 individuals. From that 9th, 18th, 32nd and 40th individual have got selected. Okay. Next is systematic random sampling. How do we do systematic random sampling? So when we do not have the exact sample frame, then we do the systematic random sampling. For example, কখন করব? ধরো OPD. Now I do not know who all will come to the OPD, how many will come to, exactly at what sequence they will come to the OPD, when who will come. There can be some repeat patients who come to the OPD. So the sampling from a OPD is actually very difficult. Okay. But at times what we do is we do a systematic random sample from the OPD. How do we do it? We say that the OPD must have a separate register of follow-up patients and new patients, so that the same patient who gets selected on Monday does not again get selected on the next Monday when they come for follow-up. Okay. So stratified systematic random is dangerous if the list has cycles. That is, if the same person is again coming later on. Okay. But what we can do is, suppose I want to do a OPD based study, I can get an estimate of the average number of people coming to the OPD by looking at the OPD registered of the last 2 years. By looking at the OPD register, like OPD registered in the month of May in medicine outdoor in last year and the year before that. If I look at that, I will get an estimate of roughly what number of patients will come. So maybe I will see that around 400 patients come weekly in the medicine OPD. Okay. And my sample size is, and of these 400 patients, maybe 200 are new patients, 200 are follow-up patients. So 200 new patients come every week to this medical college maybe. Okay. And maybe our sample collection will go on for 3 months. Okay. And we will have a total of, say, our total sample is around 100. Let's say 100. Okay. So if we are doing, now what we have to know is, are we taking the sample on every day of the week or not? Suppose we are taking it on every day of the week. Then total there are 5 weeks. So if 5 days are there in a week, then 4 weeks are there in a month. That means 20 into, so that means 20 days in a month and 3 months. That means 60 days. So 60 days, each day 200 patients. So total there will be 12,000 patients. From these 12,000 patients, I need to select 100. That means I need to select 1 patient in every 120 patients. I need to select 1 patient. Okay. So what we do is we divide. So what is 12,000? 12,000 is my estimated sampling frame. Okay. And let's make it a little bit more. Let's make it 300. Our sample size, let's make it 300. Then we need to select 1 in every 40. So if we divide the estimated sampling frame by the required sample size, then we get the sampling interval. That is, we need 1 in every 40. Isn't it? 1 in every 40. Now if 1 in every 40, now if it becomes like 1, then 41, then 81, then 121, then the person who is 3rd or 4th does not have any chance of getting selected. So how do I ensure that everyone has a comparable chance? So we have found the sampling interval, that is 40. Next what we do, that the start is determined randomly. That means if I need to select at an interval of 40, that means I need to select at least 1 interval between 1 and 40. 1 থেকে 40 এর মধ্যে অন্তত একজনকে আমায় নিতে হবে। Now this 1 থেকে 40 নম্বর পেশেন্টের মধ্যে কাকে নেব, that is decided random. So I generate a random number between 1 and 40. Suppose it comes as 17. Then I select the 17th, then I go by the sampling interval. That is 17, then 57, then 97, then 137, then 177, like this. It goes on. Okay. So the beauty of randomness in simple random sampling is in selecting the sampling interval and then selecting a random start. If my random start came as 25 and not 17, then I would select the 25th, then the 65th, then the 105th, then the 145th, and like that I would go on till my sample is satisfied. Okay. So this is about systematic random sampling. So you can see this is how the calculation is done. Okay. Calculate the sample interval by k is equal to capital N by small n, where capital N is the total study population and small n is the sample size. Like we did 12,000 divided by 300, it came as 40. So k becomes 40. Then draw a random number less than k for starting. That is, we chose one random number between 0 and 40. Maybe we selected 17, then 17, 57, 97, like this will go on. So select a random number less than k for starting and draw every k units from the first unit. So see here they selected, maybe they select the start was 3. The start was 3. So they selected the third. After that they gave a gap of 1, 2, 3, 4, 5, 6, 7, 8th one they have selected. So the sample interval here is 8. Random start was 3. So they selected 3, then they selected 11. Then again 1, 2, 3, 4, 5, 6, 7, 8. Then again 1, 2, 3, 4, 5, 6, 7, 8. So like this we go on. This is systematic random. Start is random, then after that selection is systematic. Start is random, then the selection is systematic, which makes the entire thing random. This is like, suppose you have to select households from a village. Stratified random sampling. This is what I was saying, that if the population is heterogeneous, it is having some heterogeneity. So just for that example of undergraduate medical students that we gave, the heterogeneity was with respect to, the heterogeneity is with respect to the knowledge, knowledge with respect to the years of studying, isn't it? So for that heterogeneity, we will select some from first year, some from second year, some from third year, some from fourth year. So there is some academic heterogeneity. There could be some, in some populations there could be gender heterogeneity, there could be caste heterogeneity, there could be social strata heterogeneity, there could be geographic heterogeneity, isn't it? And we would divide them into strata as applicable. Okay, and do the sampling in such a way that every strata has got a representation in the sample. That will make my sample more and more representative of the study population. Clear? So only thing here is sampling error and probability are a little bit difficult to measure. Okay, you have to calculate it. It is different for every strata. Suppose I say that I will select 25 individuals from first year, 25 from second year, 25 from third year, 25 from fourth year. Now, though the expected number of students is 150, it could be that first year has actually got 142 students, second year has actually got 137, third year has actually got 120 maybe. So the probability is little bit different from each of these strata, but it is still comparable. Okay, so just like this you see the population, in that people are there of different colors, each color represents one strata. So we first divide the population into some strata, then we do random selection from the strata and we get the sample. Okay, sometimes we might choose to have equal number of people from each strata, or sometimes we might, if the strata are very uneven, like one strata is huge. For example, if we do a stratification based on caste, then every caste, all castes are not having equal proportion of people. So there then we might say that, okay, we will want to do a proportionate selection. That is, if one strata is constituting 50% of the population, then we will select 50% of the sample from that. If one strata is comprising 20% of the population, then we will select 20% of the population from that. So this is known as proportionate stratification, or you could also have fixed stratification. That is, no, I want to find out the insights from every strata in detail. So if one strata has only 0.5% of the population, but still you want that strata to be part of your sample, so then you say that no, I will select 5 people from every strata to get adequate representation. Okay. if you make strata but you do not select randomly from the strata, you select purposively from the strata. Like I have made different strata, but I can see that some strata have only very few people. So I say that I will not select people randomly from the strata, I will choose whoever is available from each strata, I will take 5 people from each strata. Then that becomes a quota sampling, purposive sampling, and not a, because stratification is only part of it. For it to be random, this step is important. That selection of individuals from each strata has to be random. If we make strata but select individuals from the strata purposively, then it becomes quota sampling. Okay, which was a type of non-random sampling, isn't it? Non-random sampling. Now there is another type of sampling known as cluster sampling. Okay, this you need not know in a lot of detail, but still just little bit you understand. It is like strata only, but the difference is, here what we do is, we select some geographical demarcation. Understand, we do not stratify people according to their caste or religion or social status or anything. We select some groups based on natural geographical boundaries. For example, suppose I want to study the immunization vaccination coverage in one district. Now there are maybe 4,000 villages in that district. Now it is not feasible to cover every village, isn't it? So maybe I will say that okay, I will cover 30 villages across this district, and from each village we will select all individuals. Okay, so here the villages are clusters. So see, in the village there will be different kinds of people. So essentially we are not doing strata. In strata, within strata everyone is same. Okay, so we must sample from all of the strata. You understand? Suppose we make the population into some strata, then we have to sample from every strata. But clusters are natural geographical boundaries within which different kinds of people live. So essentially each cluster is like the population. So if we select some clusters, we expect that all of the heterogeneity present in the population will also be present in the selected clusters. Okay. So for cluster sampling to be effective, what we need to do? Clusters themselves should be very heterogeneous. Okay. But clusters should be similar to each other. You understand? Matlab, the people within the cluster must be diverse. But clusters, one cluster and another cluster and another cluster and another cluster, they must be more or less similar. Then only I can select few clusters and select everyone from them. If it is like that okay, I want to do, but religion wise people live in different clusters, then cluster sampling is not good. Because if I select one cluster and not the other cluster, then maybe one religion will get entirely removed, or one section, one caste will get entirely removed. Then cluster sampling is not good. For cluster sampling to be effective, clusters should be comparable, but within cluster there must be lot of diversity. Is it clear? If within cluster people are more similar and clusters themselves are dissimilar, then we must increase the number of clusters. তখন আমাদেরকে যত বেশি ক্লাস্টার সম্ভব নিতে হবে। আর যদি ক্লাস্টাররা নিজেদের মধ্যে সিমিলার হয় আর ক্লাস্টারের ভিতর অনেক ডাইভার্সিটি থাকে, তখন আমি কম ক্লাস্টার নিলেও হয়ে যাবে। ঠিক আছে? এই জন্য we calculate something known as design effect in cluster sampling, which is calculated by intra-cluster and inter-cluster correlation. ঠিক আছে? These are not things that you need to know really, but what you must understand is in cluster sampling is done based on this assumption that people within the cluster are diverse, while clusters are more or less similar to each other. That is why from a group of multiple clusters we can afford to select a few clusters. Okay, and those clusters, selecting those clusters serve the representativeness of the entire population. Okay, that is a cluster sampling. ঠিক আছে, so when we are selecting, ধরো আমরা ব্লক সিলেক্ট করছি, তাই না? ওই যে বললাম যে ডিস্ট্রিক্টে 20টা ব্লক আছে, আমি 5টা ব্লক সিলেক্ট করি, দিস ইজ আ ক্লাস্টার স্যাম্পল। ঠিক আছে, বা ব্লকের ভিতর 64টা ভিলেজ আছে, হ্যাঁ আমি 20টা ভিলেজ সিলেক্ট করে নিলাম, 64টা ভিলেজে গেলাম, 20টা ভিলেজ সিলেক্ট করে নিলাম। দিস ইজ আন্ডার দি অ্যাজাম্পশন দ্যাট villages more or less are similar. Within the village we'll find different types of people, so we'll select few villages rather than selecting few individuals from all villages. We'll select all individuals from few villages. বুঝতে পেরেছো? So as you can see, cluster sampling, it is effective in cluster sampling. So randomly selected group, all proportion or units included in selected clusters used in administrative surveys on large population. ঠিক আছে, advantage, useful in large geographical area, no list of units is required, and less travel or resources. If I can select few clusters, I need to travel less. Disadvantages, imprecise if clusters are homogeneous. Means if people within the cluster are homogeneous, then it is not a good method. ঠিক আছে, sampling error is difficult to measure, scattered distribution of cluster, then cost might be again increased. ঠিক আছে, আমি কস্ট, ট্রাভেল কস্ট কমানোর জন্য 64টা ভিলেজ থেকে 20টা ভিলেজ সিলেক্ট করতে গেলাম, কিন্তু এমন সিলেক্ট হয়ে গেল যে একদম পেরিফেরির 20টা ভিলেজ সিলেক্ট হলো, তাহলে সেই আমাকে ট্রাভেল করতেই হবে, তাই না? তাও টাইম বাঁচবে খানিকটা, তাই তো? ঠিক আছে, so cluster sampling is a more economical form of sampling. It consumes less time. It might not always reflect the true diversity of the community if the clusters are having that homogeneity heterogeneity problem. Okay, and it has a less sample size and high standard. Yes. Next, multi-stage sampling. This we have already discussed, how to do multi-stage sampling, like selecting blocks, then selecting schools, then selecting students. Multi-phase is different. Multi-phase maybe I say that first I will select, suppose I want to do a estimation, I want to find out anemia, and then I want to find out definitely that what is the severity of anemia. I want to find out first anemia, then I want to find out the severity of anemia. Then first I will have to establish who all have anemia. For that I need not do blood tests, I can do that by looking at pallor. So by looking at pallor in the eyes, in the palms, in the palates, I establish anemia. Once I have got people who have anemia, then I want to find out how many, what is the severity. So among those who have anemia, we sample again and we select few whom we will subject to hemoglobin testing. Okay, so initially in the first stage, everyone we are not sampling for hemoglobin testing. First we are sampling only general population for looking at anemia. Then for severity of anemia, we are again sampling from there to do hemoglobin testing. So this is like multi-phase sampling. Okay. Another form of sampling is known as lot quality assurance sampling. So what is lot quality assurance sampling? This is used usually for quality assurance. Lot quality assurance sampling is not used for research per se. It is used for quality assurance. মানে কি, ধরো তুমি ইমিউনাইজেশন কভারেজ দেখতে চাইছো, ঠিক আছে? এবার তুমি ইমিউনাইজেশন কভারেজ দেখতে চাইছো মানে হচ্ছে তোমার টার্গেট হচ্ছে যে অল চিলড্রেন মাস্ট বি ইমিউনাইজড, ঠিক আছে? এবার তোমার সময় নেই যে তুমি প্রত্যেকটা ভিলেজে গিয়ে সব জায়গায় গিয়ে দেখবে যে প্রত্যেকটা বাচ্চা ইমিউনাইজড হয়েছে কি হয়নি। তুমি কি করবে? তুমি দেখবে যে গত বছর কোন কোন জায়গাগুলোতে ইমিউনাইজেশন কভারেজ কম ছিল, সেই ডেটাটা পেয়ে যাবে। গিয়ে তুমি বলবে এই জায়গাগুলো থেকে, এই ভিলেজগুলো থেকে আমি 10টা করে বাচ্চাকে র্যান্ডামলি সিলেক্ট করব। দিয়ে আমি যদি বলি 3টের বেশি বাচ্চা ভ্যাকসিন না পেয়ে থাকে, তাহলে আমি বলবো যে এখানে ইমিউনাইজেশন কভারেজ খারাপ এবং আবার ইমিউনাইজেশন করতে হবে। এইটা বলে আমি চলে আসবো। আমি কিন্তু এস্টিমেট করতে যাচ্ছি না কোথায় ইমিউনাইজেশন কত, আমি দেখতে চাইছি যে যেখানে আমার ইমিউনাইজেশন খারাপ ছিল সেখানে ইমপ্রুভ হয়েছে ইমিউনাইজেশন, নাকি এবারও আমাকে ইমিউনাইজেশন করতে হবে ওই জায়গাগুলো। তো আমি কি করছি, আমি জাস্ট যাচ্ছি গিয়ে ওই জায়গাগুলোতে 10টা বাচ্চাকে র্যান্ডামলি সিলেক্ট করলাম, দিয়ে আমি আগে থেকে ডিসাইড করে নিয়েছি যে যদি 3টের বেশি বাচ্চা আনইমিউনাইজ থাকে তাহলে ওখানে আমি আবার ইমিউনাইজ করবো। সো আই টেক 10 বাচ্চাস, যদি দেখি যে একটা কি দুটো ইমিউনাইজ, আমি বলবো ঠিক আছে ওদেরকে ইমিউনাইজেশনে পাঠিয়ে দাও। আর যদি দেখি 3টে বাচ্চা বা তার বেশি আনইমিউনাইজড, আমি বলবো যে ওখানে আবার ইমিউনাইজেশন প্রোগ্রামটার ড্রাইভ লঞ্চ করো। ঠিক আছে? সো দিস ইজ লাইক আ কোয়ালিটি অ্যাসুরেন্স টেকনিক। সো লট, কোয়ালিটি, অ্যাসুরেন্স, স্যাম্পলিং। বুঝতে পেরেছো? মানে ধরো তোমার ফ্যাক্টরিতে টিফিন বক্স তৈরি হচ্ছে, তো তুমি দেখতে চাও যে টিফিন বক্সের এই ব্যাচটা পাস করবে কি করবে না, তো তুমি র্যান্ডামলি 20টা 30টা বাক্স খোলা আছে, তুমি বললে আমি একটা বাক্স আনপ্যাক করব, সেটার বাক্সর টিফিন বক্সগুলো দেখবো, যদি 2টোর বেশি টিফিন বক্স ডিফেক্টেড বের হয় তাহলে পুরো লটটাকে আমি বলবো যে আবার তৈরি করো। ঠিক আছে? দিস ইজ লাইক 2 ইজ দ্য প্রি ডিটারমাইন্ড নাম্বার। তুমি একটা বাক্স খুলে দেখলে 10টার মধ্যে 2টো খারাপ আছে, পুরোটা চেঞ্জ করো। বুঝতে পেরেছো? সো ইউ আর নট ট্রাইং টু এস্টিমেট হোয়াট ইজ দ্য ডিফেক্ট ইন দি এন্টায়ার লট, নো, ইউ আর ট্রাইং টু এস্টিমেট whether the lot fits the quality standards or not. বোঝা গেল? আচ্ছা, এই গেল হচ্ছে তোমার প্রবাবিলিটি স্যাম্পলিং টেকনিক্স। মাথার উপর দিয়ে যাচ্ছে? বেশি হয়ে গেছে? আচ্ছা, নেক্সট হচ্ছে নন প্রবাবিলিটি স্যাম্পলিং। নন প্রবাবিলিটি স্যাম্পলিং হচ্ছে খুব সিম্পল। নন প্রবাবিলিটি স্যাম্পলিং মানে আমি ইচ্ছে মতন কাজকর্ম করছি। সামটাইমস ওয়্যার ইচ্ছে মতন কাজকর্ম ইজ অলসো রিকোয়ার্ড। যেমন ধরো, সাপোজ I want to look at health seeking behavior of pregnant women. ঠিক আছে? এবার আমি দেখলাম হেলথ সিকিং বিহেভিয়ার অফ প্রেগনেন্ট উইমেন, আমি একটা কোয়েশ্চেনিয়ার নিয়ে গিয়ে অ্যাসেস করে এলাম একটা গ্রামে। ঠিক আছে? এবার আমি দেখেছি 3 জন মহিলা আছে যারা কোনো অ্যান্টিনেটাল চেকআপ করায়নি। অ্যান্টিনেটাল চেকআপ মানে জানো তো, প্রেগনেন্ট অবস্থায় যে চেকআপগুলো করাতে হয়। ঠিক আছে? তো আমি দেখলাম যে আমি একটা 3টে 4টে গ্রামে গেছি, একটা ব্লকে গেছি ধরো বিভিন্ন জায়গায়, এবং সেখানে গিয়ে পেয়েছি 10টা মহিলা আছে যারা কোনো অ্যান্টিনেটাল চেকআপ করায়নি। So now I want to find out why these 10 women are not taking up the antenatal care services. তো এটার জন্য আমার র্যান্ডম স্যাম্পলিং দরকার নেই, আমি র্যান্ডম স্যাম্পলিং করে বের করে নিয়েছি যে গেছে কারা আর যায়নি কারা। এবার আমি জানতে চাই যারা যায়নি, একদম যায়নি, তারা কেন যাচ্ছে। ঠিক আছে? সো দেয়ার আই ক্যান go and do a purposive sampling, যে ওই 10 জনকে আমি কোয়ালিটেটিভলি একটা ইনডেপথ ইন্টারভিউ করব। ঠিক আছে? তাদের একদম ইনডেপথ 45 মিনিট ধরে তাদের সাথে আমি লম্বা বসে কথা বলবো। ওটা কোনো কোয়েশ্চেনিয়ার না, দ্যাটস আ কোয়ালিটেটিভ ইনডেপথ ইন্টারভিউ। সো মেনি আ টাইমস ফর কোয়ালিটেটিভ এক্সপ্লোরেশন following quantitative data collection, for qualitative exploration we do non probability samplings. ঠিক আছে? বা অনেক সময় কিছু স্টিগমা ইস্যুস, ঠিক আছে, যেগুলোকে আমি ওপেনলি স্যাম্পল করতে পারবো না। ঠিক আছে? ধরো আমি এইচআইভি, পিপল ইনফেক্টেড উইথ এইচআইভি খোঁজার চেষ্টা করছি, ভেরি ডিফিকাল্ট, দিস ইজ ফাউন্ড ইন সেক্স ওয়ার্কার্স। সো হিয়ার উই ডু সামথিং নোন অ্যাজ স্নোবল স্যাম্পলিং। কি হলো, আমি 3 জন 4 জন সেক্স ওয়ার্কারকে পেলাম যারা ধরো এইচআইভি পজিটিভ, আমি তাদেরকে বললাম আচ্ছা তোমাদের যারা যারা চেনা জানার মধ্যে যদি কেউ থাকে যাদেরও এইচআইভি আছে তাদেরকে আমার কাছে পাঠিও বা তাদের নাম্বারগুলো আমায় দাও। তাহলে কিছু পেলাম। আবার তাদের থেকে বললাম, তারা যখন এলো তাদেরকে বললাম তোমাদের চেনা জানার মধ্যে যদি যারা থাকে তাদেরকে আমার কাছে পাঠিও। কারণ জেনারেল পপুলেশন থেকে এই স্যাম্পলটা করা ভীষণ ডিফিকাল্ট, স্টিগমা আছে, ইস্যুস আছে, প্রবলেমস আছে। কিন্তু যদি এরম ভাবে করি তাহলে স্নোবল কি করে, স্নোবল অ্যাজ ইট রোলস ইট গ্যাদার্স মোর অ্যান্ড মোর স্নো অ্যান্ড বিকামস বিগ। এইটাও সেরকম, আমি কিছু লোককে পেলাম, তাদেরকে বললাম আরো লোককে দাও, তাদেরকে বললাম আরো লোককে দাও, এরকম করে আমার স্যাম্পলটা বড় হবে। ঠিক আছে, সো উইল কুইকলি লুক অ্যাট সাম অফ দ্য কমন নন প্রবাবিলিটি স্যাম্পলিং টেকনিক্স। ফর এক্সাম্পল পারপাসিভ স্যাম্পলিং। ঠিক আছে, একটা পারপাসিভ স্যাম্পলিং হচ্ছে যে ধরো আমার রিসার্চে যেটা বললাম যে একটা পারপাসকেও মিট করছে, আমি জানতে চাই যে অ্যান্টিনেটাল কেয়ারের কভারেজটা যাদের মধ্যে পুয়ার তাদের মধ্যে পুয়ার কেন, তাহলে যারা নেয়নি তাদের মধ্যেই আমি আইডিয়াই করব। সো দিস ইজ আ পারপাসিভ স্যাম্পল। ঠিক আছে, বা ধরো কোথাও একটা আমি মলের মধ্যে একটা আমি চাইছি যে একটা মলের মধ্যে যারা হাই স্পেন্ডার্স তাদেরই আমি প্যাটার্ন দেখব, তাহলে আমি স্পেসিফিক্যালি সেই লোকগুলোকেই নিচ্ছি। ঠিক আছে, সো সামটাইমস উই ক্যান ডু আ purposive sampling. Purposive sampling is a non-probability sampling where we are selecting individuals with a specific purpose in mind. একটা স্পেসিফিক অবজেক্টিভ নিয়ে আমি ওদের সিলেক্ট করছি। ঠিক আছে, নেক্সট হচ্ছে কনভিনিয়েন্স স্যাম্পলিং। কনভিনিয়েন্স স্যাম্পলিং অনেক সময়তে আমাদের করতে হয়। ধরো কোভিড হয়েছে, আমি তো গিয়ে ডেটা কালেকশন করতে পারছি না, তাহলে কি করব? বাট আই স্টিল ওয়ান্ট টু নো দ্য সাইন্স অ্যান্ড সিমটমস, ডিজিজ প্রোগ্রেশন, ন্যাচারাল হিস্ট্রি অফ পিপল হ্যাভিং কোভিড। তাহলে এখানে আমি কি করব? আমার অ্যাকোয়েন্টেন্সের মধ্যে যত লোক আছে, বিভিন্ন হোয়াটসঅ্যাপ গ্রুপস আছে, বিভিন্ন আছে, সেখানে আমি কোয়েশ্চেনিয়ার পাঠাবো, দিয়ে বলবো তোমাদের যদি কারোর কোভিড হয়ে থাকে তোমরা ভরো, যার যার কোভিড হয়েছে জানো তাদেরকে পাঠাও, তারাও ভরুক। ঠিক আছে, সো হিয়ার আ র্যান্ডম স্যাম্পলিং ইজ সামটাইমস নট পসিবল, নট ফিজিবল। সেখানে অ্যাটলিস্ট টু জেনারেট সাম ডেটা where we know that COVID is a disease, so it will not really have very different signs and symptoms with respect to the diversity of the population. Maybe we are not expecting that it will have very different signs and symptoms with respect to the diversity of the population. Then for those we can do convenience sampling. ঠিক আছে, এখানে পসিবল নয়, সেখানে কনভিনিয়েন্স স্যাম্পলিং কখনো করতে হবে। and if my convenience sample is sufficiently large, আমি কনভিনিয়েন্স স্যাম্পল করে অনলাইন কোয়েশ্চেনিয়ার পাঠিয়ে 10,000 লোককে ইনক্লুড করে ফেলেছি, তাহলে ইট ইজ লাইকলি যে দেয়ার উইল বি সাম রিপ্রেজেন্টেটিভনেস অলসো ইফ দ্য কনভিনিয়েন্স স্যাম্পলটাই এত বড় হয়ে গেছে। ঠিক আছে, কনভিনিয়েন্স স্যাম্পল করলে কি করতে হবে? অনেক লোককে নিতে হবে। ঠিক আছে, নেক্সট হচ্ছে কোটা স্যাম্পলিং। কোটা স্যাম্পলিং যেমন বললাম, কোটা স্যাম্পলিং হচ্ছে স্ট্র্যাটিফাইড স্যাম্পলিং বাট নন র্যান্ডম স্ট্র্যাটিফাইড স্যাম্পলিং। আমি স্ট্রেটাতে ভাগ করেছি, কিন্তু স্ট্রেটার ভিতর থেকে ইন্ডিভিজুয়ালস আমি আর র্যান্ডমলি সিলেক্ট করতে পারি। বুঝতে পেরেছো? আমি HIV স্টাডি করতে চাইছি, আমি বুঝতে পেরেছি যে আমাকে IV ড্রাগ অ্যাবিউসার্স নিতে হবে, আমাকে সেক্স ওয়ার্কার্স নিতে হবে, আমাকে মেল হ্যাভিং সেক্স উইথ মেলস নিতে হবে, আমাকে ট্রাক ড্রাইভার্স নিতে হবে, আমাকে প্রিজনার্স নিতে হবে, এদেরকে নিতে হবে। এই স্ট্রেটাগুলো আমি পেয়ে গেছি, তো এই স্ট্রেটাগুলোর ভিতরে র্যান্ডম স্যাম্পলিং করা আমার পক্ষে পসিবল হয়। তো আমি কি করেছি? আমি 20টা ট্রাক ড্রাইভার, 20টা সেক্স ওয়ার্কার, 20টা মেল হ্যাভিং সেক্স উইথ মেল এরকম ভাবে ইনক্লুড করেছি। ঠিক আছে, ইন অর্ডার টু হ্যাভ আ স্যাম্পল উইচ ইজ রিপ্রেজেন্টেটিভ অফ দি স্ট্রেটা বাট নট নেসেসারিলি র্যান্ডম। ঠিক আছে, দ্যাট ইজ আ কোটা স্যাম্পল। নেক্সট হচ্ছে স্নোবল স্যাম্পলিং। এটার কথা বললাম যে বিল্ডিং দ্য স্যাম্পল থ্রু রেফারেন্স। ঠিক আছে, থ্রু রেফারেন্স। আমি 3 জনকে পেলাম, তারা আরো 6 জনকে বললো, তারা আরো 12 জনকে বললো, এরকম ভাবে গ্র্যাজুয়ালি দ্য স্নোবল গ্যাদার্স সাইজ। Okay, so this is more or less what we had to discuss. So these are the different sampling techniques. To sum up, we have sample, we do sampling to get a representative subset of individuals who resemble the study population, and the findings on whom can be generalizable to the population on whom we want to actually do the study, but we are not able to because of lack of resources, time, energy and all of this, right? Sampling can be probability and non-probability. Probability sampling এর মধ্যে যেগুলো তোমাদের জন্য ইম্পর্টেন্ট সেগুলো হচ্ছে সিম্পল র্যান্ডম স্যাম্পলিং, সিস্টেম্যাটিক র্যান্ডম স্যাম্পলিং, স্ট্র্যাটিফাইড র্যান্ডম স্যাম্পলিং অ্যান্ড মাল্টি স্টেজ র্যান্ডম স্যাম্পলিং। ক্লাস্টার আর মাল্টিফেজটাও জেনে রাখবে। লট কোয়ালিটি অ্যাসুরেন্স স্যাম্পলিং ইউজুয়ালি রিসার্চে করা হয় না, প্রোগ্রাম ইমপ্লিমেন্টেশন ইভ্যালুয়েশনে করা হয়। ঠিক আছে, আর নন প্রবাবিলিটি স্যাম্পলিং কোয়ালিটেটিভে রেগুলারলি করা হয়, কখনো কখনো কোয়ান্টিটেটিভ স্টাডিজেও করা হয় যখন র্যান্ডম স্যাম্পলিং ইজ নট পসিবল। ফর এক্সাম্পল পারপাসিভ স্যাম্পলিং, Quota sampling, snowball sampling, convenience sampling.